taking the time to join today's presentation, Preventing Opioid Misuse and Abuse Across the Ages. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. Before we get started, I'll offer a few tips so you can make the most out of today's presentation. Feel free to ask questions by typing them into the questions section of your GoToWebinar control panel, but know I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you via email. I will provide my contact information and the contact information for NeedyMeds at the end. You can find a copy of the PowerPoint slide deck in the handout section of your control panel. Also, this webinar is being recorded and will be available on our YouTube channel. So let's get started with what is NeedyMeds. What you are looking at is our mission statement, our vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, NeedyMeds.org, and a helpline, 1-800-503-6897. Here is a screenshot of our website. I like to put this up because our website is really the face of our organization. It also gives me the chance to point out a few resources I think you would be most interested in. Since I just mentioned our YouTube channel, you can find a link to it on the top right of our homepage, where all of our social media icons are. It's the third one from the left. We encourage you to subscribe. If you are looking for healthcare cost savings programs, please check out the Patient Savings tab. You can find educational information under the Advocates tab, where you will find a link to BeMedWise. You will also find a link to BeMedWise on the left side of the NeedyMeds website. So let's talk about BeMedWise. BeMedWise was a program of the National Council on Patient Information and Education, also known as NCPI, which was established in 1982. In 2017, NCPI handed off its educational resources to NeedyMeds, including their primary website, BeMedWise. Since then, NeedyMeds has operated the site. The BeMedWise goal is to promote the safe use, storage, and disposal of medicines for better health. On the website, BeMedWise.org, you can find information on safe and appropriate use of medicines, safe storage of medicines, and the safe disposal of unused medicines. Here is a screenshot of the BeMedWise site. I hope you can see and that you'll agree that this site is full of important information about the safe use of medicines. We strongly encourage you to check out this website further. But today, we are focusing on one specific initiative. Under the Get Informed navigation tab, a drop-down menu will appear. This is where you will find all the information you need about Talk About Your Medicines Month. Or you can go directly to the website, talkaboutyourmedicines.org. The BeMedWise annual Talk About Your Medicines Month is an opportunity to spotlight healthcare issues impacting communities far and wide. For the past 34 years, Talk About Your Medicines Month has chosen topics ranging from think before you drink to communication is key, to stimulate conversations between patients and their healthcare providers. The goal of Talk About Your Medicines Month is simply better health outcomes through education and improved communication. On the screen are themes from previous years. All of these themes are still relevant, so you can find more information and resources for each on the Talk About Your Medicines website under the Archives tab. Last year's theme was Preventing Opioid Misuse and Abuse. But the opioid epidemic remains a public health emergency. The opioid crisis persists. So must our efforts to combat it. So this Talk About Your Medicines Month, we are expanding the scope to include preventing opioid abuse across the ages. With all of the information available, it can be overwhelming and difficult to find reliable data. With the Talk About Your Medicines initiative, we provide the most comprehensive and up-to-date information on opioid misuse and abuse. We break the information down by age groups to help people with the most appropriate information in the most accessible way. Basically, we've created a one-stop destination for everything you need to educate yourself and take action to prevent the misuse and abuse of opioids through the ages, from keeping toddlers safe around meds to ensuring adults prescribed opioids are being responsible. So let's talk about what opioids are and some chilling facts. Opioids are a class of drugs used to reduce pain. They are often prescribed following surgery, injury, or for cancer pain. The most common drugs in prescription opioid overdose deaths are methadone, oxycodone, such as OxyContin, hydrocodone, such as Vicodin, and fentanyl. According to the CDC, use of the illegal opioid heroin has increased across the U.S. among men and women, most age groups, and in all income levels. Also, according to the CDC, opioids were involved in more than 70,000 deaths in 2017. According to Allied Against Opioid Abuse, approximately 53% of people who misused opioids obtained them from a friend or relative for free. The CDC also reports that an average of 130 Americans die every day from an opioid overdose. So let's talk about opioids and children. According to the Safe Kids Worldwide 2019 report, medicines, including opioids, are the leading cause of child poisoning. In fact, in 2017, nearly 52,000 children under the age of 6 were seen in the emergency room for medicine poisoning. Every 12 days, a child under the age of 6 in the United States dies from an accidental medicine-related poisoning. Every hour, a child is hospitalized for that same reason. But there are ways to combat this. Safe Kids Worldwide says, don't refer to medicine as candy. Referring to medicine as candy may encourage children to take medicine on their own. They also remind us that products we might not think about as medicine can still prove dangerous. Health products such as vitamins, diaper rash creams, herbal remedies, and even eye drops can be harmful if kids get into them. Store these items out of reach and sight of children, just as you would over-the-counter and prescription medicines. Speaking of out of reach and out of sight, according to the CDC's Up and Away campaign, approximately 60,000 young children are brought to the emergency room each year because they get into medicines that were left within reach. Making sure all medicines are out of reach and the safety locks are on is crucial. Save the poison help number in your phone and post it visibly at home, 1-800-222-1222. Specialists at poison control centers provide free, confidential, expert medical advice 24 hours a day. They can answer questions about how to give or take medicine and help with poison emergencies. This is just a taste of the research, resources, and tips that can be found on talkaboutyourmedicines.org about keeping children safe. Talk About Your Medicines also offers information about keeping tweens, teens, and young adults safe. Did you know that according to the National Institute on Drug Abuse, kids who continue to learn about the risks of drugs at home are up to 50% less likely to use drugs? They also share that among young adults, for every death due to prescription drug overdose, there were 22 treatment admissions and 119 emergency room visits. The Substance Abuse and Mental Health Services Administration reports the rise in misuse and abuse of prescription drugs is the fastest growing drug problem in the United States. And every day, 2,700 teens try a prescription medication to get high for the first time. Here are some actions and reminders from the Talking to Your Kids About Prescription Drug Abuse brochure you can find on our website to help protect adolescents. Speak to your teen about prescription meds. Don't presume that illegal drugs are the only threat. Avoid stocking prescription meds and keep them in a safe place. Monitor your teen's use of the internet, especially for any unapproved online purchases. Alert your family physician if you are concerned, and ask him or her to speak to your teen about the importance of proper use of prescription meds. This is just some of the information found on just one brochure hyperlinked on talkaboutyourmedicines.org under the Prevention Adolescence tab. Visit this page for tons more research, resources, and tips about keeping tweens, teens, and young adults safe. Talk About Your Medicines also offers information about keeping the older population safe. BeMedWise reports that seniors use more medicines, prescription, over-the-counter supplements than any other age group in the U.S. Older adults often use multiple medicines, increasing the risk of drug interactions, mix-ups, and potential for harmful side effects. Older adults tend to receive prescriptions from different healthcare providers. This fact can make it difficult to track medicines and identify drug interactions, harmful doses, and unnecessary or ineffective medicines. Older adults may not follow medication plans because of forgetfulness, bothersome side effects, a perception that the medicine isn't working, or the cost. Here are some actions and reminders from the Older Americans Behavioral Health Technical Assistance Center pamphlet you can find on our website to help protect older adults. Inform doctors and pharmacists about all medications, including all over-the-counter meds and alcohol use. Are medications not working? Let their doctor know. This is particularly important for pain management. Older adults may take medication in greater doses than prescribed if they are not getting adequate pain relief, which can potentially lead to misuse and abuse. Integrate screening and brief interventions into existing programs, such as medication reviews. Become familiar with and build relationships with substance abuse prevention and treatment providers in your community for cross-referrals and collaborative programs. These are just some examples of information available on talkaboutyourmedicines.org, the Prevention tab, the Older Adults link under the Prevention tab. Visit this page for tons more research, resources, and tips about keeping older adults safe. Talkaboutyourmedicines.org not only provides information to provide life-saving resources for opioid safety through the ages, but it also offers detailed information on what drugs fall into the opioid category, further details on how to take action to prevent opioid abuse and misuse, suggestions on how to guide your conversation with your healthcare providers, making it possible to make the most informed decisions with your doctor. Why safe disposal is such an important part of addressing opioid abuse. And there are even resources for healthcare professionals for counseling patients with new opioid prescriptions. You can find all of this under the Get the Facts tab. And don't forget to check out the Resources tab. This is where you will find a list of downloadable brochures and pamphlets, a toolkit with information, graphics, social media messages, and more, designed to help you participate in raising awareness about this epidemic. Under the About tab, you can find out how to be a sponsor, so please check that out as well. We're hoping you join us in preventing the misuse and abuse of opioids by visiting talkaboutyourmedicines.org, downloading the information, and sharing. These calls to action could save a life. I'm going to take a moment to answer some questions coming in from the audience. And again, if you do have a question, you can submit it by typing it into the questions section in your GoToWebinar control panel. So one question coming in is, you talked about safe disposal. Where can I find more information about that? So you can check out the Allied Against Opioid Abuse website, and you can find a link to that under the Get the Facts, Safe Disposal, an Important Part of Addressing Opioids Abuse tab. Another question coming in is, how do I know if I or a loved one should take the opioid that has been prescribed? So that's a great question. For that, you can also go to the Get the Facts tab on talkaboutyourmedicines.org to view and download pages for Use Opioids Safely, 3 Key Steps, and what I referred to a moment ago, tips to guide your conversation with your healthcare providers. Another question coming in, what if I need help finding a substance addiction clinic? You can actually find a listing, and that's a great question. Thank you for bringing that to everybody's attention. You can actually find a listing of free, low-cost sliding scale substance abuse clinics in your area on NeedyMeds.org. Click on the Patient Savings tab in the top navigation bar. When you do that, a whole bunch of categories for cost savings will drop down. On the bottom left, you will see a section dedicated to substance addiction clinics. Of course, you can always reach out to our call center at 1-800-503-6897, and they can give you that information. Just remember, we are open Monday through Friday, 9 a.m. to 5 p.m., but we're in Massachusetts, so that's Eastern Time. Now, we do like to keep the questions portion of the presentation brief, so we'll wrap it up with just those 3 questions. But remember, if I didn't get a chance to answer your question, I will follow up with you via email. As promised, here's the contact information. We do encourage you to explore the Talk About Your Medicines website. All of the information I presented, and there was actually quite a lot of it, can be found on that site. We also encourage you to visit the NeedyMeds website or give our expert call center counselors a call to learn about healthcare cost savings resources we offer. And don't hesitate to reach out to me directly with any additional questions. Thanks so much for your time, and have a great rest of the day.